So I'm Gaetane. I'm from Medtronic, and I'm the European Product Manager. And I have with me today my lovely colleague Gustavo, who's from GE Healthcare. He's also a product manager for the patient monitoring platform, but then for the EMEA region. As you can see, we're nor nurses or nor doctors. So just for you to know, for your clinical questions, it could be that we do need a bit of help to answer those, but we are, of course, well equipped to answer all your product related questions. So we're here today together because GE Healthcare has a very lovely, what you see here on the screen, CareScape system, where the Invis technology is nicely integrated. So you see it on the screen, you see the nearest value on the monitor, and it's make sure that it's very easy to use, it's very flexible, and it also will capture all your data in a seamless way, which is really important these days. So for today, we will look a bit at the technology, but just really briefly, how it works, but also when to intervene. So when do you need to take action? And then we'll dive into more practical. We will look at the ECMO patients. We will not have a lot of time for the hands-on today, but you will see some of the images on the screen that will take you through the system. And if you have any questions for us, so please don't hesitate at the end to ask them. But also, me and Gustavo, we're at the lovely GE booth over there. So please come and talk to us. And we're very friendly. So we'd love to hear your questions and your thoughts. So just for you, it's only one question today. Are you already NIRS users? Yes or no? No. Okay, that's good. Yes. I wanted to know because if you all know the technology, then the next couple of slides, would seem a bit unneeded. But as you are not, I will share with you that it's a great technology because it's site-specific. So it actually measures, if you put a sensor on the forehead of the patient, it will measure how much oxygen is in that specific site. We will talk later on, we will talk about ECMO patients. And for ECMO patients, we will see that we will also be putting on sensors on the legs. And also there, the sensors, they will give you information about the oxygen level at the leg side. So that's really great for the technology. It gives you information where you put the sensor. What it gives you is actually, it looks at the supply and the demand. With that, we mean how much oxygen is actually here, for instance, reaching the brain, but it also will depend on the fact how much oxygen is the patient also using. And that balance will be reflected in the value. So what we will see is that the inverse value is always a trend value. So you want to look at it over time. So you want to see how the patient is evolving. Is the patient, for instance, having sepsis, some kind of, infection? So is there a change in the fact that there's more oxygen or less oxygen going to the brain, but also maybe more oxygen is being consumed by the brain? And that balance will be reflected in the RSO2 value. So that value that you are measuring is not only arterial. So the biggest part, and that's important to remember, of that value is venous. So 75% venous and only 25% arterial blood. And why is that important? Because if we look to the normal value, for us, we're here today, it's the mornings, we're still in a crude condition. But overall for us, just here, normal, healthy people, the normal value could be from 58 to 82. So that's a really big variance. And so immediately that shows us that the absolute norm value is not that important. We want to look at how are our patients evolving over time. And so what is important to remember is when do you need to take action? Like what do you need to look at the patient? When do you need to do something about, or think about options? it is when the value drops below 20%. So, for instance, let's say the patient is started at 70 RSO2, then 20% off. That will do some quick maths in my head today. So if you go below 56, that will be, your cue to maybe think about or look at the mean arterial pressure, look at heart frequency, other all parameters to see like what's happening to the patient and what can I do, to make sure that more blood, more oxygen is received by that area. Another important value is that 25%. So the 25% is then the critical threshold. And what that means is that INVOS and the NIRS technologies have a tremendous amount of studies. And they show that when you go below 25%, that your impact on outcomes, is worse. So that the probability that the patient has a worse outcome is significantly higher when you go below that 25%. So that's why it's important to always intervene as of 20%. So you see me more again the screen, but if we look at in detail to the GE CareScape system, then you see that we have nicely the left and the right value. But also, we will go to the ECMO patient now. You also already see somatic 1 and somatic 2. And that's what we will need then when the legs come in for the ECMO patient. You see baseline. So baseline is that value where I talked about. So at the beginning, as early as you can, please take the baseline of the patient. So that will be then the value which you will compare the patient to over time. So the baseline value will always stay on that screen, and then you have your percentage. And remember from the previous or this slide, even it's still on, that 20%, is really the value if it goes below that you really want to take action. So nicely visible on the screen together also with the trends. So very nice because with the trend, you can also quickly from far away see if there's like a drop or that there's a rise in the RSO2. And that brings us to our ECMO patients. So for our ECMO patients, the NIRS technology is a very nice technology to work with, and it can really help you for this particular patients. So why or what are the reasons you could use this technology for ECMO patients? It is, for instance, to detect and manage the hemodynamic instability. It could also help you manage bleeding and transfusion decisions. But really important here is the detection of the Harlequin syndrome or the North-South syndrome, as you prefer to call it. And then the last one, where we will talk about more deeply on, is the distal limb perfusion. Certainly, when it's AV ECMO, it's really important to make sure that those legs are well perfused. And so why is that? These are overall numbers, the numbers of some years ago. But you see that from limb ischemia, 5.2% of patients will actually, on ECMO, will actually have that limb ischemia, and 0.7 amputation. I'm from Belgium, and when you look to the numbers for the Netherlands, in Belgium, we don't even share our numbers, but in the Netherlands, they do. And it's even higher, they have 10% limb ischemia and 2% amputation. So even for us, in those, very Western countries, the percentage is quite high. So that's why it's really a really good technology to use on these ECMO patients. We will not go into literature. It's not, our reason to be here today. But if you want to look up a really nice study, I can recommend this study from 2023. It's from Park, Roba, and Sunview, and it nicely summarizes some of the literature. So I always prefer, a nice review study. It always makes it easy for us. It combines a lot of good literature. But what is more important, that it also clearly states that NIRS technology is really the ideal technology to use on those ECMO patients. And if you remember anything from my talk today, please remember this, that why is NIRS technology, really good to use in the ICU, also in other departments? That's because it's a safe technology to use. Those sensors, they stick, they cannot harm the patient. It's a real time, so the value is updated every second. And, it's really quick to pick up changes for the patients. It's easy to perform at the bedside. You only need a monitor there. There's no, complicated setup. And it measures continuously. So it's not a spot check. It gives you information, over hours on the ICU, which is really beneficially. What is also important, that is very extensively studied, and there's a link between lower RSO2 and then worse outcomes. And what is certainly important is that there's a relation between that low RSO2 and those postoperative neurological complications, which we, of course, really want to prevent for our patients. When we look at ECMO, we also see that is reflected in guidelines. So no official guidelines yet, but interim guidelines where you also see that NIRS technology is also included. It's included for that limb ischemia, but it's also included overall for the patients to be measured on the forehead and then also on the lower legs. And so now, for you, so where do you actually place those sensors? So the sensors will be placed on the lower leg, normally on the calves. So on the calves, on the muscle, is a really nice area to put the sensors. And so what you want to do, because remember, what is now important is to know, like, when do you actually need to take action? We looked at, remember before, we looked at those 20%. But with the legs, of course, it can be different. So also here, I really recommend you to stick the sensors to the calves also as soon as you can. Because you really want to see that evolution. Certainly that distal perfusion, it could be already when they place a cannula, that the cannula is not well placed so that you see a drop, but it also could be that an occlusion could occur over time and that you will also pick up a drop. What is now different than the forehead is that for the legs, you also want to compare both legs to each other. Because of course, the leg perfusion should be quite similar, for the left or the right side. Same for the brain, we would expect the left and the right side to be quite similar. So from literature, so this is not my personal recommendation, but literature shows that when there is a drop between both legs, when you compare, of 15%, you already should, take action, because limb ischemia, it can evolve very quickly. It has a disastrous outcome, or for the patients, it impacts, of course, the patient life tremendously. So it's really important to pick up on it very early so that you could start to look at some options to correct it. Okay, and so we're already at the end of our session today. So, Gustavo, is there something you want to share with us?
Yes, I would like to show actually where we attach the invoice device. As you can see, this is the patient monitor that we use for transport. All the connectors are digital USB connectors. And what Medtronic did is actually created a device that will connect to this medical USB connectors. And this is the 7100 device, actually, as you can see here. It doesn't really matter which port you're going to be using on CareScope 1, since all of them are just medical USBs. And Gaetane was saying you have to make the reference as soon as possible. So you just put this into the patient and the invoice into the module, and you can transport your patient with this module. It will take the reference. It will save it. So it doesn't matter when you're changing from bed to bed. that reference is going to go along. I would love to show you this on the booth. We have the invoice, so the user interface, we can show that to you. So be welcome to visit us, and I can show it to you into further detail how this is working with the CareScape One, which is the name of this transport device. Thank you. Any questions? All right, Gaetane.
Couldn't hear what you are saying, Gustavo. So I think it's up to me to close the session. Yes, perfect. So I want to just leave you with those things. It's important, first of all, this measurement, the invoice or NIRS technology can really help you, to get some information on the brain, but also peripheral for ECMO patients. The CareScape technology is a really, really lovely technology. The invoice is nicely integrated, and it can give you great benefits if you actually start to go and measure the RSO2 on your patients. And I think the last one is the most important one. Remember, the technology is really safe. There's no harm you can do to the patient by measuring it. It's continuous. So you see the patient evolving over time. It's also personalized. You compare the patient to his or herself, which is really great. You can perform it at that site. And then last of all, it's real time. So it's updated every second. So it makes sure that you could capture anything very quickly. So thank you so much, ladies, for joining.